My name's Ellie, and I'm going to be talking about flow-inflating bags. So flow-inflating, different than self-inflating, needs to be hooked up to an oxygen reservoir system to deliver oxygen at all. The bag will come deflated, and then once attached to oxygen, the bag will inflate. Also, this can be turned to 100%. Different than the self-inflating, this can provide blow-by at 100% FiO2 to your patient who is breathing spontaneously, but maybe just is desetting. The flow-inflating bag can also provide CPAP to your patient. So if you have a good seal, you can see the bag will inflate. And then if your patient's still breathing spontaneously, this is now providing CPAP to your patient. Whereas if you did this with the self-inflating, your patient would not be receiving oxygen without also bagging. So with the flow-inflating, it's easy to see if you have a good seal because this bag will inflate. If we had any air escaping, this would not be fully inflated, like now. So there's a dial on the side here where you can adjust your flow and PEEP. Here's a manometer to show us our PEEP. I can turn this lower. Usually we'll start at 5, and then you can bag your patient and watch on the manometer as the pressure rises. With the flow inflating bag, it's easier to feel your patient's lung compliance as you're bagging, if you feel any resistance or anything, or if you need greater PEEP. When you pull this from the Pyxis, this will be open, and then as I'm bagging, I can feel air escaping. If you needed more pressure, this would be closed. But again, at that point, you would be conversing with RT or a doctor if you needed.